Hi, this is Dr. Ramin Tayani from the Tayani Eye Institute, ophthalmologist and oculoplastic surgeon. Today I'm going to talk about the before and after care of various different eyelid surgeries. Things like blepharoplasty, upper lid blepharoplasty, lower lid blepharoplasty, ptosis surgery, Hughes graft surgery, SUF lift. Those are some of the examples. But any eyelid surgery, the following applies. Before surgery, we typically don't need to give you any antibiotics or drops or ointments or anything to do, other than the night before surgery at midnight, you will not drink or eat anything afterwards. So if surgery is on a Thursday, midnight Wednesday is when you have your last meal or drink. On the day of surgery, you can take your blood pressure medications with a sip of water, but all other medications can be held until after surgery. You report to the surgery center about an hour before surgery, where you meet the anesthesiologist and the nursing staff and get some paperwork done, get an IV placed for sedation. Most of our eyelid surgeries are done with monitored anesthesia care, MAC, which is the anesthesiologist monitoring your vitals during surgery. You're still awake, but sedated and comfortable so you don't have any pain or discomfort during surgery. Once the eyelid surgery is complete, you'll be taken to the recovery room, ointment is applied to the wounds, and you're watched for about 30 to 45 minutes after the surgery, at which time you're discharged home with a driver, typically a family or friend, and instructions are reviewed with the family member and you at the time of discharge. Most important thing after surgery is using ice for 48 hours, 20 minutes on, 20 minutes off while you're awake. Ointment is given to you to be applied to the wound at bedtime and once a day during the day, so twice a day total. You also apply a little strip of ointment on the eyeball just before you go to bed as well. If drops are prescribed, typically we do the drops 4 times a day with a tapering program. Every week you do 1 less drop. So you start 4 times a day, then 3, then 2, then 1, every week 1 less drop. Artificial tears is always encouraged throughout the recovery time. We ask that you keep the eyes dry for 48 hours, no showering or washing the eyelids during that first 48 hours, after which you can do that. As far as exertion and exercise, we ask that you not do anything exertional which increases your heart rate for the first 7 to 10 days. Most people are black and blue, bruised and swollen for about 7 to 10 days. I tell patients if you're going to have an event that you're going to, like a wedding or a reunion or something important, typically give it 3 to 4 weeks for the lids to settle down. But going back to work, usually 7 to 10 days is fine. You can drive the next day after surgery, but not the day of surgery. This, for the most part, covers the postoperative care. Pain medicines are rarely needed. If needed, you can ask your surgery coordinator to prescribe a narcotic for the first day or 2. The last thing I'm going to leave you with is rarely there is some ballooning of the area that we've operated, meaning there is a hematoma or bleeding that happens. If that happens, I ask that you put some gauze or tissue in the palm of your hand, apply pressure, firm pressure on the eye, like so, for about a minute, so that you count to 50 and hold it for a minute multiple times a day. If you're having surgery on both eyes, you can do that on both eyes like so, or if it's just one eye, do that and it would help reduce the swelling, the bruising, and the potential for bleeding. This completes the discussion on postoperative and preoperative care of the eyelid surgery. This is Ramin Tayani from the Tayani Institute. Have a great day. Till next time.